Absolutely. So older women in particular are undertreated for a number of reasons. And a lot of it has to do with the fact that there is this age discrepancy between men and women at the time of stroke. So women tend to be older. And if you're older when you have a stroke, you are more likely to have impairments even before the stroke happens, such as arthritis or other things that limit physical function. And then the other really important thing is women who are older tend to have atrial fibrillation and hypertension, which can also lead to additional complications after a stroke has occurred. So all those multiple comorbidities, the age, and the pre-stroke function are some of the reasons why women have worse outcomes. They may be undertreated for the same reason. So they may be living alone, widowed, because they're older, and they're less likely to receive acute treatment such as thrombolysis because of the fact that they may not make it to the hospital on time. So there are timing issues as well as the social issues related to being able to get treatment. Women tend to respond to thrombolysis very well, and there's really no difference once you adjust for the stroke severity, the age, the comorbidities. Women really do have a similar benefit from thrombolysis as men, and with all of the thrombectomy trials that have done, they basically showed the same thing as with thrombolysis. So I think the important thing is to make sure that women who do have a stroke and are eligible for these treatments get to the hospital in time, get to the right place in order to be treated. So a lot of this work was done by a colleague of mine in Australia, Cheryl Bushnell, and she amassed this very large database of clinical trials and showed that women were less likely to be enrolled. And that's been shown in multiple cardiovascular trials as well. It probably relates to the eligibility, and then also that women may have different reasons for wanting to participate. They could feel that they have obligations at home that are going to prevent them from being able to participate. So I think that reason, the nuance of why women refuse or are ineligible is the kind of information that we really need to study next.